Good afternoon, everybody, and welcome to our May webinar and learning lab with the Rural Community Health Worker Network. Today, you have myself and Andrea as our old school guests from everyday life, helping to support our discussion today. As a quick reminder, our store is live and you can customize the swag for your upcoming events. And also, I'll put in the chat Rebecca's contact information if you have any questions in regards to that. And then membership is ongoing and open monthly, so please feel free to share that $25 opportunity with your friends and family that are also community health workers. We, as you know, just finished up our annual retreat, which was a huge success. It's the first year that we had officially sold out, and we are looking and planning for 2024. So if you are interested in being a collaborative host partner or know somebody who would be a great partner, again, please email rebecca@rchwn.org. So today our topic will be on social determinants of health. We are excited to invite Cheryl Berry to be our presenter and to give us our learning lab today. Cheryl, I'll pass it on to you.
Well, thank you very much for the invitation today. I am the social worker within our primary care office here at the Family Practice Center. And today I wanted to talk about SDOH. And as the title says, SDOH, what does it mean? And I'm wondering if you all have heard, I am assuming you've all have heard of the social determinants of health. And when I think of social determinants of health, the first thing that comes to mind is that those are factors, things that are non-medical, things that are outside of the healthcare system. And there's lots of different definitions that I've seen in my research and different conferences I've attended. But the one that I like the most is the World Health Organization's definition, which is on the screen there. It's really conditions that people are, they are born into, they grow, they work, they live, they grow old. It's kind of like just everything that we all experience on a daily basis. And it shapes who we are as a person. And so the social determinants of health that I have been able to research and I have learned that they are set up in 5 different categories. And as you can see, it's the education, access and quality, healthcare and equality, the neighborhood and built environments, the social and community contexts, and then of course, economic stability. They take each of these in the research and they look at each of these different groups individually. And there's lots of different research out there on each one. But what I wanted to focus on really quick is just kind of giving a quick definition of each of them. Like for the economic stability, they talk about it being the connection between the financial resources that one person may have and their health. So like they are looking at the resources that a person has for their income, what it's costing them to live, what their socioeconomic status is. And then they're comparing that with their health things, which could be, are they living in poverty? Are they unemployed? Are they working? Are they part-time, casual, seasonal? Their food securities, and then of course, housing stability. So all of those areas fall into economic category. The next one down there is the education. That's the connection between education and health and well-being, such as did the person or your patient graduate from high school? Are they enrolled in a higher education or a work program? Do they have access to educational, higher education, the language and literacy programs? Do they have any early education for childhood? All the preschools, all the child cares, all of those all fall underneath the education. The third group there is the neighborhood. the kind of the environment in which a person resides. So it's that connection between where the people live, like their housing, their neighborhood, just what kind of environment they're housed in, and connect that with their health. So once again, you have access to transportation. Do they have availability of healthy foods? I mean, is there a grocery store close versus a corner gas station or your Dollar Generals or your, there's a difference in the quality of food. Water, air quality is another one. Community violence and other crimes within the neighborhoods. We all know different neighborhoods have higher and lower opportunities for violence. And so they're kind of looking at all that. The fourth one is the social and community context. That's when you're looking at the connection between where we live, learn, work, and play, and our health. Again, we're looking at discrimination, community cohesion, civil participation, racism, interpersonal violence, workplace conditions, all those different, bigger, as I look at a macro issues within within the community. And then the last one is health and healthcare. It's the connection between people's access and understanding of the services and their own health. So once again, when I'm looking at that, I'm thinking of access to healthcare, access to our primary care offices, whether or not they have health insurance coverage, do they have language proficiency, and do they have health literacy? And are they sticking around, or are they migrating, moving from county to county, state to state, whatever it may be? Are they, like they said there, are they refugees or migrants working in your hometown? All of that plays a part in SDOH. When I was thinking about this topic, I had just finished a couple months ago attending a webinar. It was a 3-day webinar, but one of them was on the social determinants of health and DHS, the Michigan Department of Health and Human Services, and what they're doing in Michigan. So they had a work group task force put together under the Department of Health and Human Services, and they were tasked with the strategy to kind of address some of the social determinants of health in Michigan. So this is the kind of, like they call it a roadmap. I mean, it's like a 6 or 7 page document that you can read the whole thing, but I just tried to just hit on the highlights of it, just to introduce it, just so that you all could see what Michigan is doing. But it's the Department of Health and Human Services. They kind of partner with lots of private agencies, public agencies across the state and nationally to look at social determinants of health and how we might approach them. They took a long, hard look. They picked out 3 focus areas for themselves, and they are focusing on health equity, which is where everyone has a fair and just opportunity to be as healthy as they can be. Housing stability, which is all people at all times have physical, social, and economic access to safe, sufficient, and secure housing that meets their needs to have a healthy life. And food security, which is all people at all times have physical, social, and economic access to safe and nutritious foods that meets their food preferences and their needs for dietary, so that can lend itself to a healthy and active lifestyle. But with these 3 focus areas, the group obviously has a strategy to address kind of all of these over the course of these 2 years, from 2022 to 2024. And the first year, they focused a lot on just identifying all the efforts that are going on within the state, down to the local levels, nationally, kind of looking at areas of improvement where they can align throughout the, all the different work task force throughout the state. And then in 2023, they are wanting to continue to maintain all that, but they also want to look at how they can innovate, how they can grow, how they can look at more macro policies and, kind of looking at how we can improve community conditions. So it's looking at the bigger picture, not just down at the individual level. And going from that, I actually really like this next slide. It's using a river as a picture to show kind of how we can kind of move the social determinants of health. They talk about downstream, midstream, and upstream. And when I look at this metaphor here, I really think it's neat because upstream, we have all of our macro. We have all of our, like the strategy there, it says to improve community conditions. Well, in order to do that, that's the macro look. That's the big picture view of laws, policy, and just trying to create all those regulations and, kind of looking at a big view of a specific community and what that community needs to support the health of all of their people within it. And then you can look at that same group of people at a midstream, and that's kind of where you're kind of looking at the individual needs, the individual social needs, which is kind of where we're all at as social workers and, or at least where I'm at and where I think the community health workers are at. You're really looking at the individual social needs, kind of looking at where things are, happening right then and there for the patient. You're looking at screening them, all the screening questions for SDOH. You're looking at the detailed assessments. I know that community health workers have the prepare assessment. You're kind of trying to identify and inform the person immediately of the community resources that are available. And then of course the downstream, those are things that have kind of already happened and you just gotta kind of just move forward. And that's providing your clinical care at the moment of what's going on with your health at that time. And so in looking a little bit closer at this, in the research I was able to find for the upstream, the goal or the aim is to kind of identify some or try and plan ahead, prevent some problems before they even happen. So kind of, taking a look at a survey and kind of looking at what areas of a survey you might want to address and come up with policies to address it. Because then you can improve your community as a whole. The midstream, they're actually looking at providing the service directly at the moment. And they're looking at like the intermediary determinants, which would be your housing conditions, your employment opportunities, what the opportunities are for access to food, so your food securities. And then of course, again, the downstream, they're looking at the reacting to the problems as they are occurring or they have occurred. So there's three different ways, 3 different time frames that you can look at issues for social determinants of health. And I've already kind of hit on all these for the downstream, midstream, and upstream definitions. It just gives you a quick little glance at each of them. But I think as a social worker, I think it's really important for us to focus on the upstream because we can do everything we can with our patients right now at the here and now. We can put the Band-Aids on, we can provide them with all the resources within our community. But unless we take some time and some initiative and some research to really look at those, what's causing our current conditions, looking upstream, looking at the bigger picture, I don't think we're going to be able to move forward. We have to really look at what's causing the poor health within certain communities, or what's causing the the holes within certain populations. What's playing a part in that? What's missing? And so for looking at things in the upstream, research has taken 3 different approaches there that I've listed. So you're looking at social disadvantages, social or the life course approach, and health equity. I find those all very important ways of us to examine social determinants of health. And different, it's a 3-pronged approach that we can do. But I just wanted to take that idea of looking at something and really making it a visual. So for me, this next slide really allows us to look at the big picture of, let's say a community is low income. There's lots of high debt to assets, and lots of negative financial events going on. With all that going on in a community, then this is what we all see as community health workers and as social workers. We see the food insecurity, the housing, utilities, income, all those things that people come to us for. We see them happening. And how that then you also as a professional, you see how all of those things can really impact the family dynamics, family pressure. It puts pressure on the parents, it puts pressure on all the children. It just really puts a lot of economic as well as other types of pressures on a family when those things are lacking or aren't fully available on a regular basis. And so then when you have all that stuff going on upstream, kind of, out of their control, and then it leads to downstream issues of, how parents parent, how their emotions and their behaviors will impact the children's emotions and behaviors. And so it's a cause and effect. This is what's happening. So this is what's going to continue to happen with our kids, with the parenting. You end up with your abuse issues going on, child abuse and neglect. You have children problem behaviors who are, acting out, whether they're acting out at home, at school, getting into, lots of fighting, truancy, all that kind of stuff. It can be just kind of a downward effect of all the stuff that happened upstream. And so I like this visual. When I was talking to Katie about it, RCHW, it just really hit hard that this is really what we see on a daily basis here in our office, with our families and our young children, and our in the office at any given time. And then moving from that, I found a really interesting concept, which I had never thought of it. Here in Midland, we have something called prescription for healthy foods, where a doctor can just write on a prescription about, you need to be eating healthy foods or having, lots of fruits, lots of vegetables, that kind of stuff. But I'd never heard of them writing a prescription for social prescribing, where they write a script saying, you need to go talk to so-and-so about this issue. And so the concept was just it was very new to me. I hadn't, even though that's what I do as a social worker, I connect people with different resources within the community, but to put a name on it and actually have a provider saying, hey, I'm going to prescribe this to you. I need you to follow up with this. Just like I'm saying, the doctor would be saying, I'm prescribing this medicine for you and I need you to take it in order to improve your health. This would be the same concept. And so I just found it really interesting when I was doing the research. And then I wanted to just kind of talk a little bit about how in our practice here at Family Practice in Midland, We're really fortunate that we have a 20 years ago, we just started with just me as the social worker, and I developed it kind of, how can I help our patients? But over the last 20 years, we've grown our care team into a very large care team for our patients. And the most recent addition, is our CHW, Katie, and how it's been a journey of how we can work together. Katie and I doing similar things, but doing them at a different depth. We call Katie our local 211, which is our access to all of our community programs. And she's very knowledgeable on all of them. But I, as a clinical social worker, I'm able to take several of those bigger, more in-depth resources like Social Security, Medicaid, disability, unemployment, and help the patients get through those different programs step by step, online, doing applications, really getting down to, all the, step-by-step things that need to be done for those specific entitlement programs. And so it's really been a cool experience to work with Katie, who over the last year is becoming very knowledgeable on lots of our different unique resources within our community that over the last 20 years, I didn't even know existed. So it's really cool to have somebody who can really dig into things within our own community and find cool opportunities for our patients, to share them with the families that we all work with. And when I talk about our bigger picture here as a family practice center, this is our care team, as we call it, with different disciplines, interdisciplinary team here that we all work together on our own specific little expertise level, to help our patients. And one patient could be certainly with all of us at any given time during their care with us. And so I think being familiar with social determinants of health, and exactly what that means and how that comes across within a community, I think it's very important for us as individuals to be very familiar with that and how that operates within our own communities. Because this care team right here that I'm sharing with you, we all have our own expertise areas, but we also know what we cannot provide to the patient, but we know who in the office can help with that particular area. And so being familiar with the social determinants of health and your local community resources, and looking at what is out there and what's happening on a macro level, those all play a part, from the national level down to the state level, down to really your local level, and even further down into your actual community. So I really like the idea of constantly looking at social determinants of health and how we can continue to grow that knowledge, whether it's within our own practice with our own staff here, or sharing some knowledge with other people like I'm doing today, and just having those talks, those little sidebars on a daily basis as to how we can move the meter forward on these determinants of these social determinants of health, and how they continue to impact our patients on a daily basis. But wanted to hear from the people on the call a little bit about what your experiences have been with social determinants of health, and how each of you are addressing them and working towards them, and helping your patients to identify them.
Remember, you guys can just come off mute, type in the chat.
Do I have to stop sharing my screen in order to see anything in the chat?
No, if you hover over your toolbar, I'm monitoring the chat too. I'm not
Oh,
seeing
okay.
any. The Terrace said as well, you know, they identified their social determinants of health needs using the prepare form, prepare assessment. I'll open the floor to other questions as well. You know, do you guys have other questions as we're about 15 minutes to the end? I'm not sure how many slides you still have, Cheryl, so I don't want to rush you, but.
Oh, no, this is it. I really wanted to hear just how other people are looking at social determinants of health. I mean, I know we here in this office, every visit, we ask the, 3 main questions about, basic needs. Are they able to get to the doctors, finances, bills? I mean, we kind of address there's 3 main ones we do, but there's a lot more, that could be asked, but it's just hard to ask all those questions in one visit. So we've identified the top 3 and that's what we do.
How about for you, Rebecca? How are you guys currently screening for needs?
Which Rebecca are you referring to?
I think it's just you today.
Oh, okay. Well, a lot of times we have we'll have people that will call in and they'll ask for one thing, and then we start asking them questions about other issues. We have about 21 different services that we provide. We don't provide them ourselves. We are the funding for these different services that we have vendors, these organizations that provide for us. So we have, like, say somebody calls in and they're looking for Meals on Wheels. So we start off with that. And then we ask them about, do they own their own home? Do they need assistance paying for their utilities? Or do they need any kind of help within the home with keeping it clean? Or if they need repairs done? Do they have a vehicle, or do they have somebody that can take them out to get them the things that they need? Because we do have a senior transportation program. How are they doing with being able to afford prescriptions, or do they have dental services or hearing or vision? Because we also can provide that. We do have a money management program as well. So if a senior is struggling to be able to do their finances, we have a gentleman that can go out to their home, look at their bills, come up with a plan. He'll even write checks for them if they need it. So we have a lot of services that can support seniors to stay in their home, so that and it's all those kinds of determinants of health issues that we've addressed, so that people can stay in their home and they can feel secure in their home. So we try and provide those types of supports because we feel it's really important that you can stay in your home for as long as possible, because statistics have shown, or studies have shown, that the outcomes are much better if people can stay where they are. And it's cheaper, much cheaper.
I have a question on the prepare form. Under social and emotional health, it asks, how often do you see or talk to people you care about or feel close to? Is that question supposed to include family members that are living in the household or not?
I can share just from my perspective, Denise, because I was on the design team that developed the prepare assessment. And at that time, yes, it was all included in the same question.
Okay, thank you.
I think it's important to recognize that, though, when we talk about the question versus the intent behind the question. And oftentimes you'll see variances of what we're trying to get at, which can skew some of the data, but as long as you're using it in a consistent way within your organization, that's probably the most meaningful. It's great to hear from you, by the way, Denise. Andrea will be up there mid-June.
Mhm.
She'll be in Houghton.
It's nice
Where
to
do you
see you guys again.
Where do you find this prepare form?
It is online. I can drop a link in the chat. So there are 2 evidence-based social determinants of health screening tools that exist currently. There's one from the Accountable Health Communities, and there's one, it's called the Prepare Assessment. Prepare Assessment is both a screening and assessment, so it's a little bit of a hybrid. There is a use agreement, so if you end up incorporating it into your EMR, for example, there is a vendor license agreement to be aware of. Some of the vendors already have it incorporated, so Epic, for example, it is something you can turn on inside of Epic and use. And I believe NextGen has it too. But I'll drop a link in the chat, Rebecca.
Does anyone else have like the hybrid, like what we have in our office of like a social worker and a community health worker? Does anyone else have that?
Are you saying in the same office you have a social worker and a community health worker? Okay.
Yep.
Yeah, my supervisor she's a social worker and and I'm the community health worker.
Okay.
And that's a lot of times how we, if we have somebody that we really think is in need of some serious services, we will go out and do a home visit, but we typically don't do that. We have the other vendors that we use. They'll go in, we have certain vendors that will go in and do an assessment in their home. But if we think it's a really serious issue, then, and it also, if it requires more than the dollar amount limit for our programs, we will go in to do an assessment and then we can raise that limit so that we can take care of somebody at the need level that they need.
I like the fact that you have somebody who can go into the home on a regular basis as needed. Because that's one piece that we were just talking about today, that we don't have that in our, because this is a primary care office. And we don't have that ability right now, other than like home care or, that kind of service. But to have somebody actually from our office who knows the patient, who knows the situation, to go into the home and actually, really work on that kind of patient, kind of specific plan with a patient. It all has to be done within the office setting, because right now we don't have that ability to do home visits. But I think it would be an interesting workaround. So,
Well, I feel like you don't get the full picture. At least a lot of the people that we speak to, they're kind of hesitant. So sometimes it's good to see, so then you can
Right.
see how they're living and what kind of issues that they are having problems with. And you can't really hide it if we're there
right.
and checking things out. And then that way we can coordinate all of the different vendors that we use for the different scenarios. They can come in and they can make that person whole again or fix the things that are causing them the biggest issues. We just had a lady that was in our one of our senior apartments. She had called. She was very upset because she had bed bugs, and her family wouldn't come into the apartment, wouldn't come near the apartment. She didn't have any food. She couldn't get out. It just kind of exploded from there because we came in to do the assessment. And it turned out that one of her family members' girlfriends was the one that brought in this chair that she was using as a bed that had the bed bugs. So we had a company come in and do the bed bug prep, pull that chair, so that the apartment could come in and do the treatment. And then we were going to wait until we got the all clear to replace her chair with a brand new one. So, and then during that time, we found out that it was a whole can of worms that was opened up, because apparently her family members, her 2 children that she absolutely adored, were taking advantage of her financially, and it got worse and worse and worse. But I mean, we were able to connect her, like, you know, with different services. We had several different people call APS, even though they had been called before the year previous. They didn't think it was that she was worth a case. So we had enough people call after going there repeatedly to where they actually took notice. So she would never have said so much other. The only problem she gave us was that she had bed bugs, and she needed to have those addressed. So, and that's what starts it all. So then that way you can go in and see what's really going on. I mean, that's the only way you can do that with some people, because they are just not forthcoming. She did not want to get her sons in trouble. It was a big mess, and we felt very badly for her.
And that's a perfect example of all the different social determinants of health, and how all those different arenas that if you guys hadn't addressed them because she wasn't going to talk about them, that's the perfect picture of why we need to keep asking these questions and keep digging deep to find out what's truly driving our patients. Because until we actually can get to the bottom of that, we may not know.
Right.
And that's, your example is perfect. Hey, Katie, I'm going to put you on the spot. Will you talk about a little bit about how you and I work together a little bit from your perspective?
Yeah, I can.
Go for it.
Okay. Well, Cheryl and I have worked together a long time, but not in this capacity. I used to just refer people to Cheryl because I didn't do this stuff at one point, but now here I am, and she's referring people to me. So we've kind of developed a back and forth in a way, if you want to say, but because Cheryl does do entitlement programs and does do more of the financial and connecting people with insurance that I don't do, because I'm fortunate to have her here. She started doing that piece, and I'm doing if we have a patient who comes in with a positive SDOH screen, so they're in transportation, food, housing, those things come up positive, then those are coming to me. Now, we're pretty fortunate in our office. We have access to funds and access to, we're able to buy gift cards for a food center that we have in town. We're able to buy gas cards so we can pass those off to patients, especially if they have a appointment that is, an hour or 2 hours away, maybe down in the Detroit area. And so we are able to connect patients. And sometimes I met a patient about a month or so ago, and in the office and did a face-to-face conversation with this patient because the provider had pulled me into the room, and I spoke with her. We had conversations. She didn't have any food stamps. She had recently lost a job and those kinds of things. So with Cheryl being here, I was able to say, hold on, now that you've talked to me, you can also talk to Cheryl. Cheryl was able to set her up with food stamps. We gave her some job ideas. She ended up finding a job on her own, which was fine, but still that just kickstarted the whole thing. And that's just a recent example. But we do that all the time. We're constantly, she's at my desk, I'm at her desk, if we're not in with patients, bouncing each other. And then we also pull in our care managers into it if we've got patients with chronic diseases that need to be managed. So that's one example. Does that sound good, Cheryl?
Thank you,
Yeah.
everybody. And thank you, Cheryl, for being so flexible and coming on to this presentation, and all your technical assistance, Katie, on your end. We are at time, so I'm going to go ahead and close the meeting out. Look forward to seeing everybody next month. Again, be on the lookout from Rebecca for a detailed email with the recording.
Thanks, Shannon.
Take care, everybody.